Please make sure that you understand that this informational purpose is only, and it is not a place of any kind of medical advice. So do seek your medical provider for any kind of medical conditions that you may have. The gut and the brain are connected. There's a lot of research coming through currently or in the past 10 years about how the gut impacts the brain and how the brain impacts our gut. And so in other words, the bacteria balance in our gut can have a significant impact on the memory, on the way we think, on the way we react to things. And this is vital to our well-being. I see the gut as kind of being the grand central station. Okay, so you've got the hormones acting up, you've got the bugs acting up, you've got the nervous system coming into that play, you've got the digestion, you've got a lot of different systems coming into this area, including your immune system, and coming on together into this area called the gut, or the, oh, there she is.
Hello.
Welcome. I'm glad you're on. I don't think you're on Facebook yet, but you're on Instagram with me.
Yay!
So hopefully you'll be on Facebook in just a second too. But we'll see. Anyhow, we were just starting to talk about how the grand station, central station, is all in the gut, with the hormones, with the digestion, with the nervous system, with the immune system. Everything comes together in this place that we hold. And there is a two-way relationship that happens between the brain and the gut. In other words, what happens in the gut affects our brain, our health, mental health, our emotions, but also how we think, how we process information up here can also impact the gut. So it's a very interesting information that we are learning about, and we're just at the very beginning of this whole concept of the gut and brain connection, learning more about it and how it impacts our health and well-being.
We're just getting the Facebook page set up in here, so there's a little background noise. I apologize about that.
No, that's okay. Do you want to? Is there anything else you want to add to that?
Yeah, absolutely. So I'm really excited about this conversation. It's one of my favorite topics within naturopathic medicine and within health and medicine in general. And we often joke about naturopaths and how much they like to talk about poop. And that is because really the gut is one of the primary focuses of your entire system, of your entire health. So your brain, your endocrine system, your adrenals, your heart, your liver, everything really does relate very closely to the gut. So there's a lot of benefit that we can do just by healing the gut and looking at what's going on in the gut. So I'm excited about this conversation.
So let's talk about the microbiome. What is the microbiome and how does it impact us? Where does it come from? I mean, there's this whole research going on about what the microbiome is, and that we have these communities of friends, bacteria and viruses and parasites and fungi, and these are our friends, right? But the problem is that they need to stay in balance instead of going out of balance. And it's when they go out of balance that we start getting disease formation. So this community of bugs does a lot of things for us. They process food, they help with our neurotransmitters, which are these chemicals that are released to help us with emotions, whether it's anxiety or depression or whatever it may be. There is nutrients that are made by these bugs, like the vitamin K2 that is made. There is the immune system. The immune system, 80% of it is in that gut, right? So there's a lot of stuff that's going on in the gut that is very important in our well-being, because obviously these trillions of bugs do more than our own human cells do.
Absolutely. So let's define a couple terms. The microbiome is really the genetic makeup, the entire genetic makeup of every single organism. And that can be on the skin, that can be really anywhere. But when we're talking about the gut microbiome, that's the exact genetic material that's within the gut. And then when we say microbiota, That's the actual organisms. And so, as Dr. Darvish mentioned, this makeup has a lot of effect on our health. And the commensal bacteria are really the bacteria that we know are to be our friends, right? So commensal bacteria are living with us. They're actually living for us. So they're doing a lot of the processing of nutrients, like Dr. Darvish mentioned, and so forth. And actually, one of my favorite terms is animolecules, which was coined by a person named Antony van Leeuwenhoek in 1667. And he was actually discussing in a letter to the Royal Society about how really very small bugs, which he termed animolecules, were affecting his mental health, or that was his theory, that it affected all of our mental health. So he coined the word animolecules, and that's one of my favorite terms.
That's pretty cool. Very cool. So stress impacts the gut microbiome, right?
Mm-hmm.
And the communication between the microbiome and our brain is multifactorial. So when we get stress affects the quality and the quantity of these bugs, but stress hormones also can impact these bugs, and these bugs can actually increase stress in our system as well. So again, we see this two-way street between the bugs and our stress hormones, and the villi, even the little hairs in the small intestine, can also produce stress hormones. So we've got a lot of different avenues of how the gut will react to stress. That also impacts the way we are releasing inflammatory proteins called cytokines. And these inflammatory proteins that are released in the gut as a result of the bacteria balance travel in multiple ways to the brain. One way is through this nervous system called the vagus nerve, which you can kind of feel it the most superficially in this area. This is where we know that the vagus nerve is entering into the brainstem there. And the bacteria and the toxins and the inflammation responses and hormones and all of that basically are communicating with the brain through that vagus nerve, but also through the blood, right? Through the blood, and then also through these chemicals or amino acids we call peptides. And these peptides, these are chains of amino acid, which are basically they're communicators, they're signals, they're signal hormones that say, hey, be happy, hey, be joyful, hey, be less depressed, hey, be less anxious. And when we're missing anything in this system, whether it's the gut bacteria that are out of balance, or whether there is an inflammatory response going on from the food that we're eating, or the stress that we're getting from the environment and the world around us, or even electromagnetic fields and computers and emotions and everything else, all of these signals go directly to the brain and say, hey, be more anxious or be depressed. So what we are trying to do is figure out how we can balance out the connection, the interplay that happens with the gut and the brain, and hopefully calm down some of that anxiety or depression that many of us may be feeling currently in this time of our COVID days.
Yep, absolutely. So back to the vagus nerve just for a moment. What is really interesting about the vagus nerve is that it has the bidirectional activity, the two-way street from the brain to the gut, like Dr. Darvish was mentioning. And really it has a number of duties. About 20% of the vagus nerve duties are to regulate the heart, the lungs, digestion, glands, immune function, but actually 80% of its function is to carry messages from the body up to the brain. And so it's innervating very densely the gastrointestinal tract, and that's 80% of its function. So whatever's going on in the gut, that's a main line highway up to the brain. So the things that are going on in there, the toxins, the inflammation, the infections, and so forth, really just have a highway up to the brain. And so that causes a lot of the situations that Dr. Darvish was mentioning.
Yeah, so somebody was bringing up the whole concept of laptops and iPads and computers. And this is something that I'm always in argument with my kids, because they put the laptop right on their belly and they're typing away for hours. And here we are, the electromagnetic field, which is a buzz, which is a high dose of frequency, zapping, basically utterly zapping the bugs in our gut. And what that does is it damages not only our own DNA, but some of the DNA of these bugs that are so supportive for our well-being, like you were saying, Dr. Marian. And so now we're getting an imbalance of the bacteria in the gut as a result of the zapping that's going on from the electromagnetic field of the computers and cell phones.
So we've got a question by Sage Writings. Hello, Sage Writings. What is actually happening with leaky gut and how do we heal it?
You want to take that on, Doc, or do you want me to?
Sure. So with leaky gut, the more clinical term would be GI or gastrointestinal permeability, but leaky gut works just fine. Basically what's happening is that there is inflammation in the gastrointestinal tract that then breaches the gastrointestinal integrity. So an increased permeability of the gut wall, as in little holes and leakiness in the gut wall, allows toxins, microbes, waste, and larger macromolecules to get from the gut into the bloodstream where those things shouldn't be. Basically, it's like a sieve. When you drain pasta, there's holes and the water's going through the hole. We don't want our gut to be like a sieve. And this results in constant immune activation, which may lead to systemic inflammation. And so that shows up in people in a number of ways: autoimmune diseases, joint pain, fatigue, food sensitivities, and all sorts of presentations. And so we can think about what causes leaky gut, and really a number of things can cause leaky gut: infections, including bacteria, parasites, yeast, viruses. So dysbiosis, which as a whole means an imbalance between the good bugs and the bad bugs. Prematurity of birth can actually lead to really significant GI permeability. Exposure to radiation, chemotherapy as well, toxic exposures of all kinds. So we really think about glyphosate, Roundup, pesticides, anything from non-organic food that is considered a toxin. And there's really a lot of established research on the effects of glyphosate on GI permeability. And then the other things are antibiotics, as well as an immune response to environmental allergens or antigens, including autoimmune diseases and food allergies.
So that was a pretty extensive list, Doc. Good job.
I got my talking points.
You're doing great. And so, that you just reminded me to talk a little bit about the microbiome, the bacteria that we actually get through the birthing process. And the research has shown that C-section babies have a weaker immune system in a way because the microbiome hasn't been inoculated. It hasn't been activated through that birthing canal to pick up the bugs that they need. In fact, one interesting aspect to all this is that when we're in third trimester of pregnancy, the progesterone levels go up. And as progesterone levels go up, they increase the bacteria called bifidobacterium, which is a very specific bacteria that is needed for babies to strengthen the immune system, to fight off infections, to digest food, and so forth. And so babies that don't necessarily are born through the birth canal, they are missing some of that bifidobacteria that is so vital. And so these babies tend to have more asthmas and eczemas and allergies, rashes, and so forth. So the bacteria is something that we get through the mom. So that means the mom has to be very, very healthy and have a good bacterial microbiome, so that they can pass that on to the baby. And in the same way, if the mother's fighting a lot of yeast infections, or the gut microbiome is not as healthy as it can be, then that baby is getting bacteria, or the microbiome, that is not super balanced, and hence can lead to symptoms and conditions in the baby, and then as they grow up, other stuff if it's not corrected. So the microbiome is really fascinating when it comes to hormones. because if you also think about the impact of the hormones on mood, most of us are either going through menopause or PMS or andropause. And andropause is when men are going through their process. And this is relevant across the board. It's not gender specific. And so our gut creates microbiome based on the hormones, but at the same time, it helps the hormone balancing. So when you're PMSing or when you're around menopause, having hot flashes or mood swings and depression and irritability and anxiety, or you're a man short-tempered and quick to anger and depressed and just fatigued, these are all symptoms that possibly the microbiome is not producing enough progesterone, or the progesterone is not there to support the microbiome production. So when we intervene with analyzing not only the gut microbiome, but also the progesterone and the other hormone levels like estrogen, bringing everything back to balance, then we see that the mood stabilizes, that the depression goes away and the anxiety goes away and the quick impulsive anger moods go away. It's a very fascinating interaction that happens between the gut and the brain through the hormones as well. So that's one of the things that we really often focus on, is addressing the hormones and the microbiome. And Doc, how do we test for those, by the way?
So we use a number of tests for both the gut microbiome and hormones. We use something called a GI map test, which is a polymerase chain reaction, which is a scientific term for basically amplifying any shred of DNA. So any bacteria, parasite, fungi, worm, virus that is in the gut will show up on a polymerase chain reaction in a lot more sensitive way than some of the more standardized tests out there. And so it tests for about 12 to 14 of the most common species of good bugs, bad bugs, parasites, fungi, worms, viruses, and then looks at some of the functionalities of the gut, like the permeability level or the leakiness of the gut, any immune reaction to gluten, the inflammation level in general, your elastase or pancreatic enzyme function, and so forth. And so we can tell a lot about the makeup of the gut. Certain bacteria are associated with low stomach acid. Others are associated with actually dental infections and rheumatoid arthritis, autoimmune diseases, and so forth. And then as far as hormones go, we use something called a Dutch test, and that's a urine test for hormones, which is really considered the gold standard in naturopathic and functional medicine for hormones. And that is because it's very precise about the range that it's looking at and also about the number of collections. So it's averaging out throughout the whole day instead of looking at it in the blood, which is just a snapshot. For example, testosterone is going to be highest in the morning. So if you do your blood draw in the morning, your testosterone may look normal, whereas a urine collection throughout the entire day is going to actually give you a more accurate level of the testosterone. So the Dutch test really does give us quite a bit of information about the hormone levels, the metabolism, as well as a few methylation markers, vitamins, and so forth. So it really gives us a magnifying glass as to some of the more mysterious aspects of people's health.
It is one of my favorite tests, the Dutch test. The other one that I really do like doing is the organic acid test, which looks at the amino acids and the byproducts that are released into the urine throughout the day, or in the first thing in the morning, and it gives us an idea of how much amino acids and how much the microbiome are producing yeast and the byproducts of that versus the good bacteria and some of the nutrients and the heavy metals. And from that, from all of those, we can create a treatment plan that may involve IV vitamin therapy. In fact, vitamin or IV amino acids are one of the best treatments, or therapies, I should say, that naturopathic physicians use for addressing depression, because we are giving you the building blocks that are necessary for building your neurotransmitters, that dopamine, your happy hormone, your anti-anxiety hormone, your antidepressant, the serotonin. So we can use these amino acids intravenously to get there. What else do we use, Doc?
So yeah, actually just one point on the IV therapy. we can consider IV therapy pretty high on the level of therapeutic intervention. So it's not like a diet change or an herb you're taking. It's pretty high, as in that there's a little bit more risk involved. But when we think about central nervous system disorders, anxiety, depression, even something as severe as schizophrenia, memory loss, and so forth, the pathology of that person has really reached a deep layer. The central nervous system is your control center. It's obviously really important as far as our function and our ability to be a human being. So when we think about problems that are affecting that level of the system, we really want to actually jump to a higher level of therapeutic intervention to allow that person to heal on that level. And as an additional bonus, it's bypassing the gut, which is often compromised in those patients. Probably 9 times or more out of 10, the gut is really involved with those patients. So IV therapy is really one of the mainstays, especially for our central nervous system patients, Parkinson's, MS, anxiety, depression, all of those things. But among other treatments, we do a variety of things. Of course, diet and lifestyle changes across the board. We really work with the patient to see what is going to be the most effective change that they can make, that they can do on a daily basis. But we also use herbs and supplements like every other naturopath, mind-body approaches as well. But some of the things that are unique to our clinic are rectal ozone, which can be quite powerful when there's a liver compromise or rectal colon compromise. So that is inserting ozone directly into the rectum, which is connected basically, or not basically, but directly to the liver. So that allows for the liver to detox, for the colon and the rectum to detox, and actually increases intracellular glutathione. So glutathione is our main antioxidant. We love doing an IV, but we can also just boost it by inserting ozone rectally, which is fun.
You know, I love ozone therapy because one of the other things, in addition to what you just said, Dr. Marian, is that ozone has been shown to bring back to balance the good and bad bacteria. Mm-hmm. And so people who are fighting dysbiosis, which is the technical name for an imbalance of the good and bad bacteria in their gut, is causing all this inflammatory response and causing mood and depression, that ozone can actually be a form of therapy, which is just oxygen therapy in a sense, that will activate the good bacteria, kind of feed the good guys and get rid of the bad bacteria that should not be there. In addition to that, ozone has been shown from European studies that it has a great, fantastic hormone balancing component. And so people who are having an imbalance between their estrogens and progesterones and cortisol, and there was actually a question about how do we reduce cortisol. Ozone therapy can be a very beneficial way of doing that. But just jumping to that question about cortisol, so there's so many ways to reduce that cortisol, which also impacts the mood, right? If we can reduce the cortisol in the gut, we can reduce the anxiety and depression in our head to some degree. And we can also balance the gut microbiome. So remember that when we get cortisol activation from stress, we're actually creating dysbiosis, again, an imbalance in the gut bacteria in our gut. So think about when you're stressed, how you start getting bloated, right? That bloating is from the stress hormone cortisol that's produced by your adrenal glands that sit back here, but also by the villi, the hairs in our gut lining that stimulates the stress response and affects our mood, and it causes an imbalance in the microbiome. So ways to decrease that cortisol are things like phosphatidylserine, which is basically an amino acid combination that helps feed the good lining of every cell in our body, which feeds the hormones in our brains. There is B vitamins, especially B6 and B5 and B12. These are really great vitamins. Magnesium, minerals, zinc. These are all really important nutrients that help bring down the cortisol. Meditation. So just taking that time to meditate, to breathe, to let go, that actually has a quite significant impact on dysbiosis. It helps balance the good bacteria and the bad bacteria again, and also helps reduce the cortisol. So there's a lot of things that we can do in our lifestyle with the foods that we're eating more fermented vegetables, more fiber in our diet, less sugar and less animal fat, which have been shown to promote the bad bacteria growth and the yeast and the fungi, and reducing those type of foods in our diet and having more of a plant-based diet with plant-based fats like nuts and seeds and the avocados, and fermented vegetables like kimchi and sauerkraut and fermented yogurt and kefir. These are all foods that we can incorporate to help build up that microbiome in our gut. That brings me to this question, Doc, maybe you can answer it, is probiotics. What should we do with probiotics?
So probiotics is a really loaded question, especially for naturopathic doctors. There's a running joke within the naturopathic community. If you ask 10 naturopathic doctors a question, you'll get 10 different answers. But my personal feeling based on research and based on my clinical experience with probiotics is that they can be very powerful in certain situations, although they're not my first go-to, because you think about the microbiome, what's really creating the functionality of it and the beautiful many layers of abilities to shape our existence and our behavior and our mood and neurotransmitters really has to do with the makeup and the diversity. And so when you are inoculating, which just means sort of seeding or putting in a very specific probiotic with maybe 14 at the most, maybe 20 strains of bacteria, you're seeding the gut with quite a lot of a very small amount of number of bugs. And so really you should have thousands in there, and you're dumping a lot of 15 to 20 species. And so that really compromises the diversity of the gut microbiome. But that said, there's a lot of studies on probiotics with certain conditions, including ulcerative colitis, Crohn's, depression, anxiety, really a variety of things, and we see a lot of positive benefit, but it's likely that those patients have quite compromised guts to begin with, and so giving them healthy bacteria when they are mostly filled with bad bacteria can do a lot of benefit. Actually, 53% of unresponsive ulcerative colitis patients achieved remission with just probiotics, and 68% of Crohn's and ulcerative colitis patients also achieved clinical remission with S. boulardii, which is a type of beneficial yeast. So absolutely, probiotics have a time and a place that they should be used in medicine, but not necessarily on a daily basis for just trying to promote optimum health. What I actually recommend is eating more fiber and more plant proteins and more of a diverse diet. So apples, bell peppers, broccoli, protein, like everything across the board, not just one thing. And that's really going to promote a healthy diversity in the microbiome.
Completely agree with that. The way I see probiotics is also almost like a film. So when you take it, it's a film that sits right on top of the colon lining versus becoming part of the cells that continuously promote this garden of bacteria that we want, that signature that is specific to us. So I'm with you, Doc, is feed the bacteria with good food and good nutrition versus always taking a supplement. And that's one of the reasons some of these lifestyle changes like meditation and sleep and exercise and all of these different lifestyle activities help promote the good bacteria. So there's another question that's coming up around new mamas. What suggestions do we have for new mamas? Well, new mamas, one of the things that can happen if you have a genetic weakness in the production or utilization of vitamin B6 is that you can get this postpartum depression. And vitamin B6 is very, very important for multiple systems in our body and for the stress hormones, for the gut bacteria, and so forth. And so it's really important if you are suffering from postpartum depression to get checked for vitamin B6, because vitamin B6 goes down with pregnancy. Every pregnancy, your vitamin C vitamin B6 drops. If you're on birth control or have been on birth control, your vitamin B6 drops, right? Stress, vitamin B6 drops. So there's a lot of reasons why we get vitamin B6 deficiency apart from a genetic or familial condition of B6 deficiency. Therefore, it's really important to get that checked with your doctor. And then there is different types of vitamin B6, and some may work and some may not work for you. And that is something that we as doctors figure out which form would be best for you to take. So that's something for new mamas to think about. The other one is mamas need to think about their eating habits and their exercise and their sleep and hormones and everything. And so making sure that you are taking your nap with the baby, making sure that you are constantly eating during the day and feeding yourself good food, because whatever food you're eating goes either to the baby that's in your womb or goes to your milk that you're feeding to the baby. So these are some things that you want to be aware of. If your baby is having a lot of problems with skin allergies or asthma or diaper rashes or colic, there's other things that may be going on with that microbiome that needs to be addressed and corrected, or with digestion of foods that you as the mother may be eating. So there may be times when you're not digesting food, and that impacts the quality of the milk and the proteins that are found in the milk and passed on to the baby, which may be too heavy for the baby to digest. So some things to think about if you're having any issues as a new mama.
Yep.
So we've got another question. Does bone
More.
gut permeability? You want to take that on, Doc?
Yeah, absolutely. Gut broth, well, it is a gut broth. Bone broth has a lot of collagen, natural collagen in it that can really help to promote connective tissue healing. Connective tissue really is every tissue in the body that is in a bone or a nerve, and it holds everything together. And so collagen can be really supportive in healing those gap junctions, which is the term that we use for the glue between the bricks that are the enterocytes that line the cell or the intestines. So helping to heal those gap junctions through collagen and various whole food sources as well can be really supportive in healing the gut permeability or the leaky gut. So absolutely, bone broth is beneficial. Of course, you want to make sure it's really clean. Making it at home is best. Get the bones from a butcher, start to finish. You know everything that's going into it. You might even know the cow that it came from. So obviously you want it, as with anything else, from a good source, but I think it can be really beneficial. The other thing that you can do with bone broth is a form of fasting, and if going full-blown water fasting is not for you, bone broth can be really beneficial as getting protein and nutrients in while taking away the whole foods and the burden of digestion on the gut. And so that really helps to reset the gut and give it a break from digesting all the things that you normally eat.
So there's another question about avoiding lectins. Should we avoid foods with lectins? So lectins, for those of you who don't know, are inflammatory proteins that are found in plants. And one example that you can think about, in plants, lectins are produced as a source of defense for that plant. So imagine there's a caterpillar that's crawling up the leaf. That is an attack on that leaf. And therefore, what the plant does is it upregulates its production of lectins on its other side, on the other leaves, in order to poison basically that caterpillar and prevent it from being eaten up by that caterpillar. And so the lectins are, a number of them are in our foods, especially plant-based foods like the beans and the sweet potatoes and actually the grains. And that is one of the issues that majority of people have with a plant-based diet. They say, oh my gosh, I'm getting a lot of gas and discomfort and bloating. And it's because they're eating foods or preparing foods in a way where it's not destroying the lectin. And what we want to do is to eat those foods still, but prepare them properly. And if you think about the world around us, majority of the world runs on grains. They eat rice or corn, some kind of a grain that is grown. And so how could a grain be bad for us if we are growing it and majority of the world is on these? the other aspect of it is that these people are mostly around the world are using techniques to clean out the lectins off of these grains, and so that they can digest and absorb them better. And one way they do that is by soaking the rice for at least 2 hours, if not overnight. Soaking all your grains, soaking your seeds, soaking your nuts, anything that you can soak, you soak it at least for 2 hours. And then ideally cook them in a pressure cooker, because pressure cooking destroys most of the lectins and saves the nutrients. So your favorite Instant Pot or pressure cooker is a great way to prepare some of these foods. The other way we do it as a Persian, for instance, is we boil the rice and then we drain it. So you can boil your rice or quinoa with some salt and then drain it and then steam it again. And that gets rid of a lot of the lectins. Beans the same way. You want to soak them and cook them in an Instant Pot to get rid of those lectins. Sweet potatoes, baked potatoes, they taste delicious, by the way, in an Instant Pot or a pressure cooker. So try that and you might be surprised.
I'm hungry. So there's a couple of questions on reducing gut or inflammation in the gut and whether celery juice would be a good idea. So would you like to take that, or would you like me, Dr. Darvish?
You can do it.
So when we're talking, you're up. When we're talking about inflammation in the gut, we really think about a lot of different factors. As naturopathic doctors, we really focus on the root cause. So why is the inflammation there? We don't just try to suppress inflammation, which is possible with turmeric and curcumin and so forth, but we want to ask, why is that inflammation there? And that can be a number of things. I've kind of listed off a few things previously, but infections, toxins, food sensitivities, antibiotics. Glyphosate is a really bad one. Don't even get me started talking about pesticides and glyphosate and Monsanto. That's a whole talk in and of itself. But we think about the factors that create inflammation, and then we work to remove those. So of course, if there's food sensitivities, we work with the patient to try and see how we can get those foods out of the diet, and if and when we can reintroduce those foods. If there's bacteria or parasites, we work to clean those out. If there is glyphosate and other toxins, we work to detox. Oftentimes there's heavy metals, especially in slightly older population, including myself. At one time, we had mercury amalgams in our teeth. And that just constantly seeds, those silver amalgams seed mercury into the gut all the time. My gut is full of mercury. I'm working on that every day. So we work up to remove the factors that can create inflammation. Celery juice is, of course, the medical medium's one big treatment to cure everything. And I don't necessarily see it that way. Juicing vegetables, of course, can be really beneficial. One risk of that is that it will really stir up heavy metals in the body, especially if you're using celery, parsley, cilantro. Those things are actually metal redistributors. So they're going to pull heavy metals from the brain, from the nervous system, from the bone. And if you're not putting the correct sort of building blocks in place, or the treatments in place to grab those heavy metals and get them out of the body, they're just going to get redistributed into other places. So you can think about lead going from the bone to the brain. That's a bad idea. So you really want to work with a naturopathic doctor to make sure that you're doing the kinds of things, that you have the kind of diet, that you have the treatments on board that are going to bind up those heavy metals and keep them from redistributing in worse places, such as the brain. So celery juice may be a good idea. It depends on the person, but often can have a lot of risk involved. And so we really just, we stray away from saying this one thing is going to cure everything to begin with, but definitely not celery juice.
So one note, thank you for that. One note about the heavy metals is that heavy metals can be a cause of depression and anxiety, mood, hormonal imbalances, thyroid problems, and the list can go on. Neuropathy, numbness, tingling, diabetes, chronic heart disease, kidney disease. A lot of these chronic conditions often have a heavy metal toxicity component to it that must be evaluated and treated. So like Dr. Marian said, it is really important to get the mouth checked, because it's not just about the metals in the mouth. Also, there's hidden infections that can happen in the jawbone. And I'm hoping some of our dentists are here on the call, but some of these infections can be very low grade, and many of us won't have a symptom. We won't have pain, we won't have pressure, we won't have anything in the jaw, but these infections are creating and eating creating problems in the jaw that travels down the lymph system and can go to the breast and cause breast cancer, can go to the heart and cause heart attacks, can cause all sorts of different conditions, autoimmune diseases and so forth. So that is one of the other things that we are really adamant about checking, is checking the jaw and the lymphatic system around this whole area to make sure everything's draining and that there is no infections in the jawbone. I'm guessing there is probably one more question, Doc. If not, maybe our time is almost up.
Uh-oh, this is so fun.
It is a lot
I think there is one more question. Well, that one's a little bit more complicated, but this one is, how do you test for heavy metals? We use a test called the oligoscan. There's also a hair metals test, and we sort of weigh the pros and cons of either test. The oligoscan is something more repeatable that we can do in office and make sure things are going down. We can see if mercury or lead or aluminum is more of a problem, and then target treatments at that specific metal, and then monitor it with treatment, make sure it's improving. And then the next question is...
After that, there is also DMPS or EDTA challenge,
Yep.
which involves giving you an IV of these chelating or binding agents, and then we have you collect urine or stool afterwards. We used to do a lot of that kind of testing, and now since the oligoscan, which is less stress on the kidneys, is available, we are tending to do more of that. It gives us a more sensitive reading off of the tissue. So that's one of the things that we're using. Sorry to interrupt, Doc.
No, please do. There's another question. What is the test for the jaw called? That's sort of it's a really large question. There's a lot of different things that can go on with the teeth, with the oral cavity, with the gums. So there's no one test, unfortunately, but we do work very closely with biological dentists, which are, to some extent, the naturopaths of the dental world, and they have specific training in looking at the teeth at a much closer level, as well as the effect that the teeth have on systemic health. So they're much more familiar with autoimmune conditions, with neurological conditions, and with the really severe effects that the dental and the oral cavity can have on systemic health. So we work really closely with them, and that might involve imaging, cultures. They'll take a swab and culture what's going on as far as the bacteria and spirochetes going in the mouth, as well as looking at some of the bigger problems. So root canals, silver amalgam dental fillings, something called cavitations, or neuralgia-inducing cavitational osteonecrosis, NICO, basically wisdom sight removal gone wrong, which happens about 90% of people, and other issues. So we work hand in hand with biological dentists to really address each of one of those specifically and make sure that the patient is ready for those interventions, because a lot of them involve